My name is Dr. Shafiq. I'm a neurosurgeon at the Premier NeuroSpine Institute, and today we're here to talk about sacroiliac joint dysfunction, an important but under-recognized cause of chronic low back pain. The sacroiliac joint links the pelvis to the spine. It's a very important joint for the transfer of forces and weight from the lower extremities up to the spine and upper body. It's supported by a very large number of strong muscles and ligaments. It's a joint which normally does not move very much. SI pain is caused by incompetence of the ligaments that support the joint. They can either become degenerated or they can get injured in an accident. Sacroiliac pain can occur on one side or both sides. Studies suggest that 15 to 30% of chronic low back pain may be coming from the sacroiliac joint. I first became interested in the sacroiliac joint because I had seen many postoperative lumbar fusion patients who were continuing to suffer from debilitating low back pain. And upon examining them, I noticed that they had significant pain emanating from the sacroiliac joints. Other studies suggest that up to 43% of post-lumbar fusion symptomatic pain may be coming from the sacroiliac joint. Patients with sacroiliitis will usually complain of low back pain, which at times can radiate into the hip, the groin, or the buttocks. It may be associated with the sensation of numbness and tingling and weakness in the lower extremities. I also hear patients say that they feel like their legs are giving out on them when they're walking. They may have a hard time finding a comfortable position to sit in, and they have a difficult time going from sitting to standing. SI joint pain is particularly challenging to identify and diagnose because it doesn't show up on CAT scans, X-rays, or MRIs. When making a thorough diagnosis in patients with chronic low back pain, I look at the patient's presentation and history. I perform a thorough physical examination. I look for the Fortin finger sign. We ask them to point to where their pain is. They point to a location just above the buttocks, right where the dimple is in the low back. And then I perform a number of provocative maneuvers. I perform a diagnostic sacroiliac joint injection to determine whether or not the pain is emanating from the sacroiliac joints. When patients are first diagnosed with sacroiliac joint dysfunction, it does not automatically mean that they need surgery. They may try more conservative therapies first, such as physical therapy, wearing a brace, pain management with injections and/or a radiofrequency ablation. If patients fail to improve from these conservative modalities, they may be a candidate for surgical intervention. The iFuse procedure is performed with the patient laying on their belly. Usually 2 to 3 implants are placed depending on our patient's anatomy, and the procedure takes about an hour. Following an SI joint fusion, the patient will go home the same day. They only have some limitations in activity such as bending, twisting, and lifting. I do ask patients to use a cane or a rolling walker for protected weight bearing for about 4 weeks. I'm confident that iFuse is the best implant to offer my patients because of all the peer-reviewed literature that backs it up. If you or someone you know is suffering from chronic low back pain, give our office a call. I'd love the opportunity to become a part of your care.